Hello, this is Dr. Tall Paul Simon, psychiatrist. Wanted to talk to you a little bit about sleep apnea, different types, how it's treated, and my personal experience with sleep apnea. So, the term sleep apnea means without breath, okay? So, it's basically a disorder of breathing when you're trying to sleep. There's a bunch of different misconceptions about sleep apnea that I don't see addressed in different articles that you see online, at least not very often. So the basic premise behind sleep apnea is that if you're not breathing well at night, your brain will not be oxygenated or get enough oxygen, and then you have health problems as a result. So some of the symptoms of sleep apnea are cognitive issues, depression, poor energy, headaches in the morning, and other kind of signs and symptoms of not getting good oxygen at night. So a lot of times the people that I see in my practice who struggle with sleep apnea aren't responding well to antidepressants, and their depression may be better in some ways, but they're still tired and just dragging and lack of concentration and motivation problems. And so they'll say, well, my antidepressants aren't working that well. And it may be the antidepressants, it may be sleep apnea, maybe other things like I've mentioned in other videos, like low vitamin D or B12 or other things. Sleep apnea is one of those conditions that is sneaky and can hide behind a lot of other symptoms and conditions, but actually be a central thing that needs to be addressed. So how is it evaluated? Well, first you talk to your doctor about it and say, hey, I'm having all these problems. First, you got to speak up, okay? So, and the doctor will ask you a bunch of different questions, what your sleep habits like and different things. Now, one of the main misconceptions that I run into with people is that they're tired during the day, they don't feel rested, they have all these different symptoms of sleep apnea. They say, well, I sleep fine at night. I can fall asleep just fine. I sleep throughout the night, but I just don't feel rested. I can't have sleep apnea because I sleep fine. Well, perception is not always reality, okay? When they do a sleep study, oftentimes they'll find that the person is not actually sleeping well. So how that works is basically your brain wakes up just enough to take a deep breath, okay, after you stop breathing perhaps, but you're not reaching a level of actual consciousness. You're waking up just enough for your brain to respond and take a deep breath and then go back to sleep, and then it happens all over again multiple times an hour. And it's a problem throughout the night, but the person never really actually fully wakes up and is conscious that that's happening because they're just so tired and exhausted that they don't notice it. But they notice the effects of it later on. So first misconception is that you don't have to think or feel like you're not sleeping well. You just have to notice or suffer the effects of not sleeping well. The second misconception is that all people snore who have sleep apnea. Well, that's not true. In adults, only about 70% of people that have sleep apnea snore. So you may not snore at all, but you're not breathing well. Maybe your partner or somebody who sees you sleep may notice you gasp for air or suddenly start, breathing after pausing for quite a while, and that may cause sleep problems for your partner, which has been, the case with my wife. She's now sleeping a lot better now that my sleep apnea is treated, because she's not essentially seeing if I'll ever breathe again in the middle of the night once I stop. So the misconception being that everybody with sleep apnea snores is not true. There's another nuance to that misconception, is that kids can have sleep apnea. That's not a misconception, that's the truth. But kids oftentimes will not snore at all, even if they have really bad sleep apnea. So while snoring is a common symptom of sleep apnea, it's much less common in kids. So some kids may snore with sleep apnea, some may not. Snoring is not an indicator, but it is a warning sign for sleep apnea. A lot of times, little kids that don't respond well to their ADHD medications, they're having behavioral problems and mood problems throughout the day. They may not seem tired at all. They may be bouncing off the walls. But as any parent will tell you, if a kid is tired and sleepy, they may, you may just see it in their behavior. They may be cranky and moody and just hyper, and they may not react like you or I would, just falling asleep at our desk, but rather the opposite and just bounce off and not know what to do, bounce off the walls and stuff. So it's less reliable, all those indicators, those common symptoms of sleep apnea when it's a kid. One thing that can lead to sleep apnea in kids is allergies and big tonsils. So a lot of times the treatment for sleep apnea in kids is actually having your tonsils removed. And honestly, their pediatrician can look and see if their tonsils are really big and maybe obstructing things, and that might be a clue. I've seen cases of severe treatment-resistant ADHD in 14-year-old kids not responding to multiple ADHD medications. You get a sleep study and say, gosh, look, there's huge sleep apnea, and once you get that treated, the ADHD resolves, or at least mostly resolves. So it can hide in kids and doesn't always fit the stereotypical pattern of symptoms with snoring and perceived poor sleep. Another misconception about sleep apnea is that it always causes fatigue, okay? Now, sometimes it can be more just cognitive effects of sleep apnea, like the depression and concentration issues that I talked about. So if you're concerned about sleep apnea, okay, let's talk about how it's worked up. Now, I snore. My dad snored horribly, and neither one of us were really much overweight. I'm a little bit overweight now in middle age, but not much. Typically, somebody with sleep apnea is more likely to be male, more likely to be overweight, a thick neck. I obviously don't have a real thick neck. I have a skinny pencil neck. So somebody looking at me would say, well, that guy probably doesn't snore. But looking a little bit closer, I'm middle-aged, I have a desk job, kind of flabby, it's narrow, big nose, but narrow. So probably some issues there that can predispose me to sleep apnea, and I do have sleep apnea. So it's easier to diagnose and treat than it used to be, because now that we have CPAPs and all that, people used to just die in their sleep or have heart attacks and things. Strokes, high blood pressure, kidney problems, all these things are possible sequelae or results of untreated sleep apnea. So it's very important to get your sleep apnea evaluated and treated if you think you might have it, or if your spouse or partner thinks that you might have it. In my case, it's my wife that's really been expressing the concern, and finally I got it addressed this past year. So how it's evaluated: you go to your doctor, they may refer you to a sleep specialist that is trained in evaluating these different conditions, including restless leg syndromes and other sleep disorders. And nowadays they have take-home sleep studies. They will actually mail you one, and comes in a little packet and has the wires to a little electronic computer, a box, and you follow the instructions and you connect yourself up to the little wires and stuff, and it records you while you're sleeping. And you don't actually have to go into a sleep lab like they used to. Now, if the test is inconclusive, they are not as accurate as the full sleep study in a sleep lab. But if it's inconclusive, they'll send you to a sleep lab anyway, usually. And that's where they really hook you up to a bunch more wires, and they actually will videotape how you're sleeping and measure how often you move around and different things. And so it's much more detailed and much more sensitive. Now, assuming that you have sleep apnea after one of these tests, what do? Okay, you use a CPAP, continuous pressure airway protection. So that's what the CPAP stands for. In more severe cases, there are BiPAP. So it's instead of just pushing air into your nose, it will actually suck air out so you can exhale. So it's inhale, exhale on the BiPAP, whereas CPAP is just pushing air in to kind of essentially inflate you as a balloon so that air flows. It's usually just on the nose, you know, a little device there, and kind of look like a scuba diver to some extent. It was really difficult for me, honestly, to go in and get the device because it's kind of embarrassing, or you know, maybe my vanity or something was my pride was standing in the way. You know, it's just made me really feel old to get a CPAP, and so it was difficult to overcome that. But honestly, I do feel a lot better since getting even my mild sleep apnea treated. So I feel better energy, better focus and attention. I think my mood is a little better. I certainly feel more rested in the morning. So even though my sleep apnea is mild and I really didn't want to address it, I do feel a lot better having it addressed. And honestly, my wife feels a lot better having had me address it as well. So that's a win-win, and it reduces my risk for cholesterol or high blood pressure and cardiac issues down the line. So if any of this rings true to you, please get your sleep study, get your sleep apnea addressed, and don't fall for those common misconceptions that I mentioned before. Okay? So you all take care. Thanks for watching the video. Please like and subscribe, and I'll catch you later. Bye-bye.